The Africa Centers for Disease Control and Prevention has ramped up efforts to help countries use up COVID-19 vaccines before they expire. Millions of doses are at risk of being destroyed as vaccine rollouts have stagnated across the continent. CGTN's Nick Mudimba takes a look at the situation in Kenya.
This was early 2021 when the COVID-19 vaccination drive was at its peak in Kenya. Long queues as the public tried to get that life-saving jab.
3 years down the line, and many public and private hospitals in Kenya have stopped pushing the vaccination drive agenda. Many of those locations where vaccinations used to be done are now being turned to car parks and recreational centers.
Members of the public in Kenya's Nairobi business district feel like easing of the restrictions gave confidence in the public health sector.
A number of people are vaccinated.
A lot of people have been vaccinated and COVID-19 has reduced. It's not serious the way it used to be 3 years ago, and that's why hospitals are not pushing people.
The hospitals push.
The public has forgotten how the pandemic caused havoc. Right now, there's the Marburg virus scare. No one even bothers.
COVID-19 is still here with us. The rates have got down, and even if you watch news today, there are no announcements in regards to infections and deaths.
The number of vaccine doses administered each month in African countries has been in decline, according to the World Health Organization. So far, less than half of the continent's target population has been fully vaccinated.
To date, we have received 1,092,000,000 vaccines. 1,092,000,000 vaccines for COVID-19 on the continent, and we have administered 973 million, which gives us an administration rate of 87% of the COVID vaccines that we have received. To date, those who are fully vaccinated, we have a coverage of 44.72% of the target population, which for us is 12 years and above. This corresponds to 415 million people have been fully vaccinated on the continent of Africa.
The Africa CDC is supporting governments to prevent or reduce the expiry of vaccines. These interventions include setting up of new COVID-19 vaccination centers, improving logistics of supplying vaccines from the cold rooms to the centers, and countering negative perceptions of the vaccine through community engagement.
To date, 12.2 million cases that we've documented on the continent, 2% of the total global cases of COVID-19. We have had, unfortunately, losses of almost 257,000 people, giving us a case fatality rate of 2.1% here on the continent of Africa.
Last year across Africa, the expiry of vaccines was reported in Kenya as well as Uganda, Malawi, Senegal and Nigeria. Nick Mudimba, CGTN, Nairobi, Kenya.